Good morning, and today we're going to talk about the basic elements of a sit-to-stand transfer from the wheelchair up into standing. Although this seems like a very elementary procedure, there are basic precepts that need to be followed consistently every time for safety, both the patient's safety and your safety. So let's talk about those in general. Firstly, before the patient is to be moved from the wheelchair on any occasion, the brake should always be locked. And so in this case, the brake mechanism is pushed forward until you feel it click, and you'll see how the brake is engaged by compressing onto the tire. You'll do this both sides, watching your body mechanics throughout. Of course, if you can trust the patient to lock their own brakes, that's ideal. And you should always encourage the patient to be responsible for that, but be aware that they may not always follow that instruction. Secondly, you're going to explain to the patient what it is you're trying to accomplish, and you need to plan ahead so that your wheelchair is facing the direction in which you want the patient to move, or it's parked at an appropriate point next to the surface that the patient is transferring towards. Plus, you may start off in front of the patient in order to assist them, but you will always transition to the side that is more involved in order to guard. Should their knee buckle or they have some loss of balance, it's going to be more likely that they will fall towards the involved side. Of course, if they're transferring to another surface, you need to be out of the way. So you will always lead with the uninvolved side. That's an important key to a safe transfer, is that the uninvolved or the lesser involved side, the quote stronger side, is going to lead. So then you can be out of the way and on the involved side. So planning ahead is important. Once you have the patient parked where you want them and the wheelchair is locked safely, the patient is going to remove their feet from the footrests, which would normally be in the start position. And then you're going to remove the footrests, keeping them completely out of the treatment area in order that you don't trip anyone, and preferably off of the floor for hygiene purposes. Now, as you can see, the wheelchair has some depth to it, and for safety, a patient is usually scooted all the way in the back of the chair for safety and comfort. So in order for a patient to work most efficiently in getting up to stand, you'll ask the patient to scoot forward in the chair. It's a shorter distance and a better mechanical advantage to come up to stand from the front edge of a chair. So we'll talk further in other labs about methods of scooting, but ideally, in an ideal world, the patient can scoot one hip at a time and be positioned on the front edge of the chair. Prior to doing that, though, you want to put the gait belt around their waist, or if necessary, up above their waist around the axillary region, and we'll talk about reasons that might apply. But wherever it's going to be a good anchor, and you assist the patient on with the gait belt, threading the belt loose end through the teeth side of the buckle and back into the locking side. So once they have on the gait belt, then they scoot to the edge, and you must be guarding them at that point because they're vulnerable. They're closer to the edge to the extent that they might slip off or they might fall. So you must be ready, positioned in order to prevent any problems. Then you'll explain to the patient that they are in charge of the transfer wherever possible, and ask them to count to 3, and you will assist on a 3 count. You'll explain to them too that they're to use their hands to assist in the transfer, and that's one of the uses of the armrests. So they have on their belt, they've scooted to the edge, and you will place their hands if necessary on the armrests and tell them that on a count of 3 they're going to lean forward. The cue nose over toes sometimes helps, and on their count you're going to help them as needed to push up. They're to push with their hands and of course push with their feet, so that they're giving optimal independent effort, and then you are just assisting them. So in this case you would say, okay, on your count of 3 we're going to work together. Push with your hands, push through your feet, and come on up to stand. So the patient would say 1, 2, 3, push. So that's the basic elements of getting up into standing from the wheelchair, with the wheelchair safely locked and the patient safely protected with the gait belt. The gait belt is not just used for gait, as you can tell, and should you have to give the patient some assistance, you will be actually pulling through the gait belt, and until you know how much assist they need, you will actually hold onto the gait belt at all times because of the risk of their knees buckling or they're having a syncopal or fainting episode. So unless your hands are on that gait belt, you're not going to be prepared to assist.